Chapter 11: Reproductive Behavior. Reproductive behavior is an obligatory component of the reproductive process. This is one of the strongest drives in animal kingdom and usually takes precedence over all other forms of activity, such as eating, resting, and sleeping. This promotes opportunity for copulation, thus increases the probability that the sperm and egg will meet. This also consists of stages such as the pre-copulatory stage, the copulatory stage, and the post-copulatory stage. These stages are considered as serving the functions of attractivity, proceptivity, and receptivity. Attractivity are behaviors and signals that serve to attract males. These include postures, vocalizations, behaviors, and chemical cues such as pheromones. Proceptivity are behaviors exhibited by females towards males that stimulate the male to copulate or reinitiate sexual behavior after copulation. Examples of this are headbutting of male, mounting the male, female and female mounting, which sexually stimulates the male. Receptivity ensures insemination. This includes immobility or standing response, as well as tail deviation or backing up towards the male. General difference between male and female when it comes to reproductive behavior. For females, sexual receptivity occurs only during estrus and is characterized by distinct behavior and mating posture. Short period of sexual receptivity limits the time during which pre-copulatory behavior occurs in most females. For males, this occurs potentially anytime after puberty. Stages of reproductive behavior. The first stage is pre-copulatory behavior. This includes the search for the sexual partner, courtship, sexual arousal, and erection and penile protrusion. For the search for sexual partner, this requires most of the senses, which are olfactory, visual, auditory, and tactile. For the courtship, it is generally under the influence of the female, wherein the female sends subtle or overt signals to males to initiate courtship behavior. Factors such as sexual signaling pheromones, vocalization, increased physical activity, and subtle postural changes are signals provided by the female that will initiate more intense courtship behavior on the part of the male. The post-pubertal male is almost constantly searching for signals sent by the females to indicate that she is sexually receptive. Sexual arousal. This happens after courtship-specific behaviors, which include sniffing of the vulva by the male, urination by the female in the presence of the male, exhibiting phlegm behavior, chin resting, circling, and increased phonation. Sense of vision is the most important with regards to sexual arousal in male. Erection and penile protrusion follows sexual arousal. Lordosis, which is the mating posture by the female, triggers significant sexual arousal behavior on the part of the male. This highly specific female motor response associated with the willingness to mate. Next is the copulatory behavior. This is classified as sustained copulators like the boar, dog, and camelids, or short copulators such as bull, ram, buck, and tom. This includes mounting, intromission, and ejaculation. For the mounting, this requires immobilization of female and elevation of front legs of male to straddle the caudal region of the female. The intromission is the entrance of the penis to the vagina. Ejaculation is the expulsion of semen from penis to the female reproductive tract. Past sexual experiences are important in order for the male to develop appropriate reproductive behavior. For example, negative experiences during the pre-copulatory and copulatory stages will generally result in less enthusiasm on the part of the male. Management of breeding male should always be directed towards providing the male with totally positive stimuli. Lastly, the post-copulatory behavior. This includes the dismount, the refractory period, and the memory. For the dismount, either male, female, or both will not engage in copulatory behavior. For the refractory period, second copulation will not take place. For the memory, important in both positive, such as promoting productive behavior, and negative ways, such as inhibiting reproductive behavior. These tables show the typical behavior during the search, courtship, and consummation by the female and male domestic animals. Reproductive behavior is programmed during prenatal development. During embryogenesis, sexual differentiation occurs during which the brain is programmed to be either male or female. Feminization. Alpha-fetoprotein is produced and it prevents most fetal and maternal estradiol from crossing the blood-brain barrier and entering the brain. Since estradiol is prevented from entering the brain, the embryo becomes fully feminized because it has not been exposed to estrogen. Defeminization and masculinization. This includes high concentration of estradiol in the brain, which reduces the likelihood that the animal will express female-like behavior post-pubertally. This will help develop male-like behaviors after puberty. In most mammals, reproductive behaviors are sexually differentiated. Mounting, erection, and ejaculation are typically male behaviors, while lordosis, crouching, and increased locomotion are typically female behaviors. These behaviors are endocrine controlled. Examples are the sequential treatment with progesterone and estradiol, which induces sexual receptivity in ovarectomized females, and testosterone will restore reproductive behavior in castrated males. Among farm animals, ovarectomized females that are treated first with progesterone to mimic the luteal phase of the cycle and then treated with estradiol display maximum estrous behavior. Ovarectomized females that are treated with testosterone develop male-like behaviors. They will even develop secondary sex characteristics such as reduced pitch of voice, hump on the back of the neck, and atrophy of the female reproductive tract. Reproductive behavior is controlled by the central nervous system. Reproductive behavior can take place only if the neurons in the hypothalamus have been sensitized to respond to sensory signals. Testosterone, which is produced in small episodes every 4 to 6 hours in the male, is aromatized to estradiol in the brain, which promotes reproductive behavior. There is a relatively constant supply of testosterone and thus estradiol to the hypothalamus in the male. This allows the male to initiate reproductive behavior at any time. In contrast, the female experiences high estradiol during the follicular phase only and will display sexual receptivity during estrus only. Under the influence of estrogen, sensory inputs such as olfaction, audition, vision, and tactility send neural messages to the hypothalamus. These neurons synapse directly on neurons in the ventromedial hypothalamus as well as the preoptic and anterior hypothalamic regions. These sensory inputs cause neurons in the hypothalamus to release behavior-specific peptides that serve as neurotransmitters. These neurotransmitters act on neurons in the midbrain. The neurons in the midbrain serve as receiving zones for the peptide produced by the hypothalamic neurons. The midbrain translates neuropeptide signals released by hypothalamic neurons into a fast response. Neurons in the midbrain synapse with neurons in the brainstem. These nervous signals are integrated in the medulla. From the medulla, nerve tracts and to the spinal cord, where the nerves synapse with motor neurons that innervate muscles that cause lordosis and mounting. The olfactory and vomeronasal systems respond to pheromones that trigger reproductive behavior. Secretions, either vaginal and urinary secretions in estrus from the female reproductive tract, serve to sexually stimulate and attract the male to the female. Pheromone. This is a volatile substance secreted or released to the outside of the body and perceived by the olfactory system and or activated by the vomeronasal organ. This causes specific behavior in the recipient. This can also be priming pheromones that have physiologic rather than behavioral effects of recipient. Males also produce sex pheromones that attract and stimulate females. And examples of this is the boars, which produce specific substances that cause sows and gilts to become sexually aroused when they are in estrus. Next is preputial pouch secretions and pheromone-like substances present in saliva secreted by the submaxillary salivary glands. Phlegm behavior is a close-range investigative behavior. Some pheromones appear to be less volatile and need to be detected by the vomeronasal organ in the bull, ram, stallion, and to some extent the boar. The vomeronasal organ is an accessory olfactory organ which is connected to two small openings in the anterior roof of the mouth just behind the upper lip. Fluid-borne, less volatile chemicals can enter the vomeronasal organ through the oral cavity by means of the nasopalatine or the incisive ducts. Vaginal secretions and urine evoke an investigative behavior known as the phlegm response. Phlegm behavior allows less volatile materials to be examined by the sensory neurons in the vomeronasal organ. Phlegm behavior is characterized by head elevation and curling of the upper lip. This closes the nostrils and allows a negative pressure to fawn into the nasopalatine duct. Thus, less volatile materials like mucus and urine can be aspired through the duct into the vomeronasal organ where they can be evaluated by sensory neurons in the organ. Phlegm behavior in males is likely performed whether the material is from estrus or non-estrus female. This is used to identify mating opportunities in males. Females will display phlegm to novel compounds, including fluids associated with the placenta, newborn animals, and other volatile materials. Phlegm is frequently displayed by post-parturition females as they make identity discriminations between their own versus others' neonates. Auditory stimulation can serve as a long-range signal. Visual signals are valuable for close encounters, and tactile stimulation is generally the final stimulus before copulation.
Penile erection and protrusion complete the precopulatory phase of reproductive behavior. Successful penile erection requires a complex series of neural and vasomotor reactions. Erection. It is necessary for copulation and deposition of semen. It is characterized by marked increase in the rigidity of penis, the result of marked increase in arterial inflow of blood when compared to venous outflow of blood. Next, dilation of corporal sinusoids. Next, elevated intrapenile pressure. Next, relaxation of the retractor penis muscle. The basic steps in the erectile process. Step 1. Erotogenic stimuli cause sensory nerves to fire. Step 2. Sensory nerves activate reproductive behavior center in hypothalamus. Step 3. Stimulation of parasympathetic nerves that innervate penile arterioles. Step 4. Parasympathetic nerve terminals release nitric oxide. The nitric oxide initiates biochemical cascade that causes erection. Erection of the penis requires sensory input and a local vascular response. The penile erection is a complex series of neural and vasomotor events. These events can be broadly subdivided into nervous component, which is the cerebral and spinal, and the local vascular component within the penis. The nervous component, which are the cerebral and spinal, are arousal-driven, and there must be appropriate sensory stimuli, tactile, visual, auditory, and olfactory, in order for the central nervous system to be appropriately stimulated. Next, the local vascular component within the penis, the eretogenic stimuli, is extrinsic. It is synapsed with para and sympathetic efferent neurons that control penile vascular smooth muscle. Next, the nitric oxide is the principal neurotransmitter that drives the erectile process. And the non-eretogenic conditions. The CGMP is acted upon the PDE5 or phosphodiesterase 5, and this enzyme promotes the conversion of CGMP to GMP. This breakdown causes increased vascular tone, resulting in outflow of blood from the corpora cavernosa and loss of an erection. Figure 11 to 9. Vascular and biochemical control of an erection. For the anatomy, the shaft of the penis consists of two dorsolateral corpora cavernosa and the corpus spongiosum. Arterial blood is supplied by the internal pudendal artery that supplies the dorsal and deep cavernosal arteries. Corporal sinusoids are supplied by hyoid arteries. The deep dorsal vein and superficial dorsal vein drain the erectile tissues. For the flaccid penis, the sinusoids are flattened because adrenergic nerves secrete norepinephrine that causes vasoconstriction. Blood flow to the cavernous tissue, therefore, is quite low for the majority of the time. Since no eretogenic stimuli are present, non-adrenergic, non-cholinergic parasympathetic neurons do not fire and thus do not release nitric oxide. Therefore, vasoconstriction takes precedence over vasodilation. For the erect penis, when eretogenic stimuli are present, the NANC neurons fire and release nitric oxide from their terminals. When NO is released, it activates an enzyme called guanylate cyclase. This enzyme converts guanylate triphosphate to nitric non-guanosin monophosphate, or CGMP, and causes the smooth muscle of the corporal sinusoids to relax. The cavernous sinusoids engorge with blood and intracorporeal pressure increases dramatically. This compresses the venules through which blood exits the penis. Blood is then trapped within the penis, causing an erection. Figure 11 to 10. The characteristics of copulation, site of seminal deposition, and number of ejaculations, saturation, and exhaustion in the rump, bull, stallion, and bull. In the mating pair of the rump, the duration of copulation is 1 to 2 seconds or 1 pelvic thrust with 4 leg thrust. For the volume of ejaculate or range, it is 0.8 to 1 ml or 0.1 to 2 ml. For the site of semen deposition, it is external cervical OS. For the average number of ejaculations to satiation, it is 10. For the maximum number of ejaculations to exhaustion, it is 30 to 40. Next, for the mating pair of the bull, the duration of copulation is 1 to 3 seconds or 1 pelvic thrust with 4 leg thrust. For the volume of ejaculate or the range, it is 3 to 5 ml or 0.5 to 12 ml. For the site of semen deposition, it is in the phomix vagina. For the average number of ejaculation to satiation, it is 20. Maximum of 60 to 80 number of ejaculations to exhaustion. For the mating pair of the stallion, the duration of copulation is 20 to 60 seconds. It is multiple pelvic thrusting, flagging of tail, followed by inactive phase. The volume of the ejaculate is 75 to 120 ml. For the site of semen deposition, it is external cervical OS, but semen enters uterus at high pressure. For the average number of ejaculations to satiation, it is 3. For the maximum number of ejaculations to excisions, it is about 20. For the mating pair of the boar, the duration of copulation is 5 to 20 minutes. This rapid pelvic thrusting to engage penis in cervix. When penis is engaged, thrusting stops and ejaculation commences, that is accompanied by somnolence. For the volume of ejaculate, it is 200 to 250 ml. For the site of semen deposition, it is in the cervix and uterus. The average number of ejaculations to satiation is 3, and the maximum number of ejaculations to excision is 2. Figure 11 to 11. The characteristics of copulation, site of seminal deposition, and number of ejaculations to satiation and excision in the camel and llama. For the camel, the duration of copulation is 6 to 20 minutes, extension of neck, straining of the body, multiple ejaculations per copulation. For the volume of ejaculate, it is 3 to 8 ml. For the site of semen depositions, it is partly intrauterine, partly intracervical, some intravaginal. For the average number of ejaculations to satiation, 22 matings in 24 hours. For the maximum number of ejaculations to excision, there are no data available. For the llama, the duration of copulation is 20 to 30 minutes, body tremors and pelvic thrust. For the volume of ejaculate, it is 1 to 5 ml. For the site of semen deposition, it is intrauterine. For the average number of ejaculations to satiation and maximum number of ejaculations to excision in the llama, there are no data available. Figure 11 to 12. Copulation in the dog. The vasculature of the dog penis has been injected with latex and the tissue dissolved away, leaving cast of the vasculature. Red vessels are arteries and the blue vessels are veins. IL stands for ileum, MCA stands for medial caudal artery, LCA stands for lateral caudal artery, IS stands for ischium, A stands for acetabulum, CS stands for corpus spongiosum, CC stands for corpus cavernosum, DPA stands for dorsal penile artery, DPV stands for dorsal penile vein, and the OP stands for O8 penia. BC stands for bourgeois liania. PLVG stands for pars longa glandis. PA stands for prostatic artery. IP stands for internal pudendal artery, and the IIA stands for internal iliac artery. The first stage coitus. The male mounts the female in a manner typical of a quadruped. The female holds the tail to one side and the penis is introduced into the vagina by a few thrusting movements. This stage of copulation lasts for only 1 to 2 minutes. The first and second fractions of semen are ejaculated during the first stage coitus. Next is the turn. This is the transition between first stage and second stage coitus. Shortly after ejaculation, the dog dismounts and turns around while lifting one hind leg over the beach. Next, the second stage coitus. After the turn, the animals stands with their hind quarters in contact and their heads facing opposite directions. The third fraction of semen is ejaculated during the stage. Second stage coitus may last from 5 to 45 minutes. It is believed that the purpose of second stage coitus is to encourage uterine rather than vaginal insemination. Turning around discourages the dehiscence of the penis and therefore maintains high intravaginal pressure. The dog steadily ejaculates up to 30 ml of seminal fluid that is delivered through the cervix into the uterus. This phenomenon tends to force the sperm-rich fraction into the uterus. The copulatory behavior described here is perfectly natural. Unfortunately, this behavior is often interpreted as being unnatural, and attempts to break the tie are often made by the uninformed. Such intervention compromises fertility because delivery of semen to the uterus over a sustained period of time is reduced. Reproductive behavior and spermatozoa output can be manipulated. Under conditions of artificial insemination, where repeated seminal collection is necessary to maximize the harvest of spermatozoa, understanding the influence of novelty and mating situations is important. The Coolidge effect. It is defined as the restoration of mating behavior in males that have reached sexual satiation, when the original female is replaced by a novel female. In other words, a sexually satiated male can be restimulated if exposed to a novel female. Next, the sexual stimulation. It is defined as the presentation of the stimulus situation that will achieve mounting and ejaculation. The purpose is to obtain ejaculation or mating in the shortest time possible so that manpower involved in managing the mating of animals can be minimized. The three approaches to introduce sexual stimulation: introduce a novel stimulus animal, reinitiates sexual behavior after sexual satiation of pulse, change stimulus setting, and both. For the figure 11 to 14, the introduction of novel females and the change of locations has a positive effect on mounting behavior. It is hypothetical examples, not experimental data. A familiar female may stimulate a bull to mount about 12 times in an 8-hour period. The SS stands for sexual satiation. Bulls can be stimulated to mount after satiation by changing the stimulus setting or new location. This induces more total mounts, or 18 mounts, than the familiar female, which is 12 mounts. The sexual preparation. It maximizes output of spermatozoa per ejaculate. It prolongs sexual stimulation, and it may include false mounting, restraint, and false mounting plus restraint. In false mounting, deviating the penis during a mount so that inclination cannot occur. For the restraint, it prevents male from mounting even though he wishes to do so. In false mounting plus restraint, it will result in greatest improvement of spermatozoa output. While sexual preparation is taking place, release of oxytocin from the posterior pituitary occurs. Oxytocin causes contraction of the smooth musculature surrounding the tail of the epididymis and the ductus deferens. These contractions transport spermatozoa from the tail of the epididymis into the ductus deferens and eventually into the pelvic urethra. Once the sperm gain entrance into the pelvic urethra, they begin to mix with secretions from the accessory sex glands. Figure 11 to 15. The major steps in sexual preparation resulting in transport of spermatozoa from the tail of the epididymis into the pelvic urethra. First step is in the sensory stimulation in the optic, olfactory, tactile, and auditory. Next step is the stimulation of nerves in the supraoptic and paraventricular nuclei. Next step is the release of oxytocin from posterior pituitary. Next is the contractions of smooth muscle in distal tail of epididymis and ductus deferens. And the last step is the transport of spermatozoa into an ejaculatory position. The homosexual-like behavior. It is common among domestic animals, especially in cattle. It implies a sexual preference for same-sex partners. In animals, there is not a preference, but rather indiscriminate orientation or same-sex directed behavior. Thus, an alternative term that is applicable to subprimate animals would be homosexual-like behavior. What is the evolutionary advantage of animals displacing this kind of behavior? The first explanation theorizes that cows mounting each other provide a visual signal that attracts a bull to the cow in estrus. The second theory explaining the evolution of homosexual-like behavior among cows involves an inadvertent genetic selection by man for this behavior. It has been proposed that cattle of European descent were selected by humans for their estrus behavior. Cows with a high degree of mounting behavior were inadvertently selected because they were noticed by man and offered a greater opportunity to become pregnant. Thus, this behavioral trait was transmitted to their offspring. Artificial insemination requires an understanding of reproductive behavior and physiology. The two fundamental ways to collect semen from male is the use of artificial vagina and the electroejaculation. For the use of artificial vagina, it is a device that stimulates vaginal conditions of a female in estrus. This design should accomplish the following: provide a suitable environment for stimulation of the glans penis, provide an environment that prevents damage to the penis, and provide an environment that maximizes sperm recovery and minimizes sperm insult. Last is the electroejaculation. It is electrical stimulation of accessory sex glands and the pelvic urethra, generally used in males of high genetic value that cannot physically perform mounting and ejaculation, and it is used in range bulls. Figure 11 to 16. The artificial vaginas for various animals. The typical artificial vagina consists of a sturdy outer casing, a rubber liner, a chamber filled with warm water, a rubber collection funnel, and a collection tube. The artificial vagina for the stallion consists of a leather outer casing, or the letter C here in the picture, equipped with a port to drain water, the arrow here in the picture, the collection vessel, the CV here in the picture, and the protective covering, the PC here in the picture, are shown. Ideally, ejaculation takes place in the collection tube cone, or the CC here in the picture, so that most of the semen will drain directly into the collection vessel. The artificial vagina for the bull consists of a black casing, the C here in the picture, a rubber liner, the RL in the picture, a collection cone, the CC here in the picture, and a collection vessel, the CV here in the picture. Water is placed between the casing and the liner. The proper temperature is critical for successful ejaculation in the bull. While not shown in the photograph, a protective covering is placed over the cone and collection vessel to prevent cold shock of the semen. The artificial vagina for the boar consists of a bulb that can apply pressure to the artificial vagina. High pressure is obligatory for stimulation of the glans penis and ejaculation in the boar. The artificial vagina for the boar also consists of an outer casing, the C here, a liner, the L here in the picture, and a protective covering, the PC here in the picture, that houses the collection vessel. The artificial vagina for collection of semen from rumps and packs consists of a rubber casing, the C here, with a valve, the arrow here in the picture, through which water can be added or emptied, a rubber liner, and a collection vessel, or the CV here in the picture. The protective covering is shown above the artificial vagina. Figure 11 to 17. Surrogate stimulus animals for semen collection. In general, males of most species can be trained to mount and ejaculate using surrogate stimulus animals. A surrogate stimulus animals provides ease of weaning and minimizes the risk of injury and disease transmission. Further, surrogate stimulus animals do not require feed, housing, and labor for maintenance as does a live stimulus animals. The use of artificial stimulus animals requires previous training of the male. Once the male has been trained, he will generally mount the dummy readily. The size can be adjusted easily to accommodate various needs. Mobile surrogate stimulus animals are used for collection of semen in bulls because the collection can be changed with ease. In the picture, it is the phantom for stallion semen collection. The surrogate stimulus animal is used to collect semen from the stallion is generally referred to as phantom. The fan contains a biting valve to provide stallion with a surface to bite during mounting, thus providing a means for natural heat. All of the devices shown have a built-in artificial vagina in which the temperature and pressure can be controlled.